If you have a medical, our doctors are in. Email it to greatdayhouston@khou.com so our doctors can help you out. Every January, the gyms are full of people trying to get on track to a healthier lifestyle. Our next guest says it's also a great time to set a plan in action for healthier teeth and gums. Please welcome back Dr. Terri Alani with her dental boot camp for 2011. Hello.
Hello.
And this is important, not because you just want whiter teeth or want to avoid cavities, but studies show that if there's something wrong in the mouth, there can be something wrong in the other parts of your body.
Exactly. In 2011, a lot of people have made New Year's resolutions. Some of us stick with them, some don't. But the thing is that we're all trying to focus on health, and this is a great time to get your mouth a healthy, fresh start.
All right. The first thing you got to do is call and make an appointment. And I know people who say, oh, I haven't been in years, and they want to lie on the form and say, when's your last visit? Well, it was just last month, right? But you're like, look, we're not going to embarrass you, and that's fine.
Exactly. You have to remember, we're patients too. None of us like going to the dentist, but we need to do it for our health. And so just when you call, just let the staff know that it's been a while, and we'll understand. And you can talk over your fears with us, and we'll take it from there.
Yeah. All right. The first thing to do is maintain oral hygiene, and that is, okay, brushing. And most of us think we know how to brush. I mean, you've been doing it your whole life, just about. And we're going to have one of our audience members here, Alyssa, who is just going to, Alyssa, I just want you to start like you would on any morning, just brush your teeth. And how many times a day should we be doing that? Some people say after every meal.
Well, ideally after every meal, because what you want to do is you want to, dislodge all the particles and everything. But twice a day is pretty standard.
Okay.
And we'll be happy with that, yes.
When you wake up and when you go to sleep,
when
or
you
after
wake
lunch?
up, after breakfast, after dinner. If you can carry a toothbrush after lunch is great also. And I'm watching her brush her teeth, and she's actually doing a pretty good job. What patients might not know is that how long should you brush your teeth for?
Yeah, well, we'll just see. Well, hold on with that. Hold on. We're going to put up a little, let's put up, we have a little clock up right here. Okay, what kind of toothpaste? Because you walk up there and there's 5,000 different choices.
There's too many different choices. It's very confusing, but basically what you want to do is you want to get one that actually has the ADA approval on it. It's very difficult to read.
Alyssa, you can stop when you think you're pretty good.
You can go,
no, stop when you think you're done. Okay, yeah.
You can go to the store, and most all of the toothpaste have ADA approval. One with fluoride. There's different types of whitening toothpaste, but just basically a toothpaste that has fluoride in it.
Yeah, okay. The other thing is the toothbrush. I know they say you can use a soft one, but I just feel like I'm not getting it unless I have the hard bristle brush.
But Deborah, you are, because what you need to use is a soft to medium.
Oh, wait, hold on now. Hold on. So you're done? Mm-hmm. Okay, she stopped at our clock at 1 minute and 8 seconds. You stopped brushing your teeth. Okay, so is that about your average every morning? Mm-hmm. All right, how many of you do it for at least a minute every morning? Yeah, about a minute is about your time. Okay, Terri?
All right, believe it or not, it's 2 to 3 minutes, which is the length of a song. Like, put a song on the radio, your iPod or whatever, and the length of the song. And I tried it this morning. Actually, I'm probably short on brushing too. And I realized that, and the other thing is you want to do it in very, a 45-degree angle. Hold your brush to a 45-degree angle and avoid that heavy death grip.
Okay.
A lot of people brush like this, and that will cause erosion of the enable and sensitivity and inflammation of the gums.
And with that really tough bristle that you're like causing problems for the gums.
Yes.
You need to keep brushing. Okay. We'll let you know when you can stop. We'll let you get an adequate brushing in. Yeah, just go ahead and do that. Okay. All right. Floss. Flossing is one of those things that a lot of us, we start out doing it like after we've gone to the dentist, and then we stop within the week.
Exactly. 1 out of 10 people don't even use floss, and only half of Americans say that they do floss. Flossing is super important because it actually dislodges the food particles in between your teeth. And the other thing it does, it cleans and polishes your teeth. It prevents gum inflammation. Basically, the types of floss, I actually like waxed floss because it's easier to get in and out. But if you have very tight teeth, you might want to go with unwaxed. And there's also floss threaders that you have on your table there that can help.
Okay. Take a full set of x-rays. You don't know what's happening. Don't wait for pain to set in, because usually it's way too late.
The worst mistake people can make is come to the dentist and go, oh, doctor, I just want my teeth cleaned. I know they're fine. You have got to take a full set of x-rays. That is the only way that we can do a comprehensive exam. It's like going to my brother, having a broken arm, and saying, fix it. He has to have an x-ray to see where the break is.
And you'd rather fill a cavity than have to do a root canal.
Exactly.
So get it early.
We can detect things a lot quicker, decay in between teeth, abscesses, tumors, cysts. X-rays are essential, and we use digital, so the X-ray exposure, radiation is 75% less.
Wow. Okay, and you also need to be very mindful, because it could mean your life. I mean, it's something as simple as looking inside your mouth. Oral cancer exams.
Oral cancer exams are essential. I know we did a segment a couple of weeks ago. We have a new device called the Identify 3000. It's quick, it's painless, it takes 3 minutes, but it'll save your life.
Okay, deep cleaning. Who might need a deep cleaning?
A deep cleaning would probably be for anyone that hasn't had their teeth cleaned in a long time. If you have a lot of tartar in between your teeth, again, x-rays are vital in showing that. And remember, a lot of us are driven by fear, but remember, also think about if you lose your teeth.
Yeah.
That would be the fear that should drive you to go in and make that appointment.
Yeah, yeah. All right. I think that maybe, ding, I think that maybe you're okay now on brushing your teeth over there. Okay, good. Thank you very much.
I also wanted to say something else that people might not be aware of. Bacteria in the mouth can spread to your partner. So I'm telling you, before you kiss your spouse or your partner, you better make sure they have their teeth cleaned.
Yeah, especially if you're kissing like they do in the movies.
Yes.
Yeah, okay. So, all right, replace old fillings if the dentist advises, because, again, they might not be permanent and they start to lift and stuff can go underneath
if you're my age and you still have silver fillings in your mouth, you need to get them replaced, because basically what happens is the silver fillings over time, I hear it from patients all the time, well, doc, it doesn't hurt. Remember, we're a preventive profession. We catch things before they cause lots of problems. Right. What happens with the silver fillings is they can actually contract and they can cause gaps in between the teeth and you get decay underneath them.
Yeah,
so
and plus, isn't the other side prettier? Because
yes.
now you fill them with different things.
We have the natural white fillings, yes.
Now, when you said if you're my age, people were thinking, oh, 25. So
yes.
basically, yeah, no. so yeah, that's a misleading thing there. Okay, easy tips, water to the rescue when you can't get to brushing.
Exactly, use water. Water actually neutralizes the acids, and it will help. It helps. I mean, water definitely helps.
Yeah, and then chewing sugarless gum is okay.
Sugar and sugarless gum is great, because what sugarless, that's a tongue twister. Sugarless gum does is it actually increases your saliva by 30%, and so it can help prevent cavities.
All right.
And the other thing, last thing, is when you go and have your coffee, drink it through a straw. You might want to not drink red wine through a straw because it looks funny, but if you drink tea or coffee through a straw, it prevents the staining on your front teeth.
All right. Dr. Alani has a special offer just for Great Day viewers. You can get a free comprehensive dental exam with the purchase of a cleaning and x-rays. This offer is for new patients only and is good through the end of January. To take advantage of this special, call Dr. Alani's office at 713-621-5141, 713-621-5141. You can also find her on the web at Texastoothlady.com. Dr. Alani also co-hosts a radio talk show with her brother. You saw him earlier, orthopedic surgeon Dr. Wayne Alani, every Tuesday at 1 p.m. on CNN 650. When we come back,